Sir? Sir? Was he conscious at all? Where's his friend? Where's his friend? Was he conscious at all?
No, when he fell down, he just...
Can you tell us what happened?
He was just walking and he just tripped. I don't know what exactly happened.
Okay. Sir, what's his name?
Chris.
Christopher? How you doing? Alright, we gotta get him. We're all going through number. She's gonna see something.
Ready?
On your count.
1.
Wait 1 second. Pete, can you help us out? Get down. Roll their legs. Alright, on your count.
1, 2, 3.
Towards that. Okay. Get room to get 6 minutes. That's kind of odd. Chris? Alright. Checking. Pulse, everything. How's things looking up there?
Looks like he has a cut on his forehead.
On his forehead. The pressure for now. Taking breathing. Can we get out O2, 15 liters? My mask on just to start. Pretty strong pulse. Things are good. People probably, I feel like sometimes they underestimate the amount of training that we go through. They think, oh, we're just kids, on college campus who, know how to open a Band-Aid and, call for additional help or something like that.
I decided I was going to take the EMT class, and I guess I did not know what I was getting myself into at first.
The classroom requirements for becoming an EMT is 160 classroom hours.
Started in June, ended in August. It was 3 hours a night for 3 nights a week, for those 3 or 4 months.
So I guess do the math and then figure out how many hours that comes out to in terms of class training. But in addition to that, we have a lot of time outside of class where not only do we have to study and practice skills and things like that, but also we have to dedicate time to working in an ER in the ED emergency department of a hospital.
Even with extensive training in the past outside of MERT, coming to MERT is a totally different type of EMS. You don't have an ambulance, you don't have a lot of the extra equipment you're going to have coming from an outside agency. So there's a lot of operational issues and training that you really need to go through to become a member of MERT. Whether you're an EMT, whether you're first aid certified, CPR certified, or absolutely nothing at all, there's some type of training for you. For the training for MERT, you really have to be trained better than the people in the ambulance. People think of us just as the Band-Aid crew or someone's coming to take care of the drunk. But we really have to be at a higher level of training than the people in the ambulance because we don't have the ambulance. We don't have all the excessive equipment at our disposal. And if someone is seriously ill, it might take them 15 minutes for an ambulance to ride. So we have to be at the top of our training to provide top level care at the time when it's really needed.
You can be the perfect EMT student. You can get a 100 on the class, but you throw that person in the back of an ambulance, or you throw them into a shift as an EMT and ask them to perform EMT procedures. It's not like the class at all. There's a lot of additional training, such as working with people and the humanity aspect of the whole thing. It's very easy when you're in a classroom setting, when you're asking someone questions and they're giving you coached responses. When you're out in the real world, things don't go exactly according to plan. And I'd say that's maybe one of the biggest learning curves.
How you doing?
Chris, the ambulance agency should be here soon. They'll transport you to the hospital, okay?
But after all this is done, you kind of get a bigger glimpse at what we're about and what we do and what we had to do to get to where we are. And you might ask at this point, why do you do it?
Why do MERT? Why volunteer my time and even stress out about it so much when it's completely optional and completely volunteer? But I think for me and for a lot of people in MERT, the bottom reason, is a cliche, but we want to help people.
When I was working in the trauma bay, we actually had a medical 500 come in. Medical 500 is a term used in the local area to reference a cardiac arrest of some kind, and the patient crashed just as they pulled up at Strong. So they walked in doing CPR. My preceptor looked at me, asked if I knew CPR. I said yes, and he told me to get in there and start doing CPR. I was doing CPR on a 70-odd-year-old patient, and it was real. It wasn't just this idea of doing it. It wasn't the training on the dummies. This was real. I was actually being told to do CPR on an actual patient, and it was the most amazing thing I've done in my life, because for once what I was doing mattered.
I never really got into it until I had my first cardiac arrest call, where I was still 16, and you know, it just showed however much training and knowledge you have that you're not always going to win. But I wanted to be that person that had the most knowledge on scene, and wanted to be one of the people that really could potentially make a difference in someone's life.
At the end of the day, even sometimes people who aren't helpful, aren't friendly, don't really like us, people who've spit on us or puked on us or done grosser things, we still at the end of the day are satisfied because, you know, we have helped someone somehow. Whether or not they see it now, whether or not they ever want to believe it or think it, you know, it's satisfying to know that I've helped someone else.
The first time that you actually make a difference in someone's life, the rewards are better than any paycheck. And we keep coming back to make that difference. And you might not get the thank you at the end of the day, you might not get the pat on the back, you might not get anything, just maybe puked on. But if you know that you made a difference in that person's life, that's all that matters.